different curves and in the vertebral column. Primary curves and secondary curves. Primary curves, we have them at the first day after birth. But secondary curves, after, for example, passing some months, you can see these curves. I told you, you can memorize them by sacrum, the shape of the sacrum. It's posterior side. Then change one by one. Lumbar region, thoracic region, and cervical region. Sacrum is primary because this is the shape of the bone. And again, change one by one. This is lumbar to the anterior. This is sacrum is primary, lumbar is secondary. Thoracic again is primary and cervical is secondary. I told you when you can see cervical curves. After the time that baby can control the head, it means it has this curvature now, after 2-3 months. Lumbar curvature again is secondary. We have it when baby can stand up. We can see this curvature. I told you the problems in the vertebral column. Kyphosis, lordosis, and scoliosis. Scoliosis to the right or left. Scoliosis. Then we start here. Typical vertebra. Okay? I told you when you remove one bone, one vertebra, you can see different parts. First of all, you can see body. This part. This part is body of vertebra. The big bony part. From superior view, this is body, anterior side. Look at the lateral view, this is body. Body of vertebra. Body of vertebra attach each other. All of the bodies attach each other. With one cartilage. Yes, it's like a disc between the bodies. Okay, intervertebral disc. Intervertebral disc. When you found the body, behind the body we have two pedicles. Two structures go back. This is body, these two are pedicle. They go back, they are here. Pedicle. On the pedicle we have two lamina. We have two lamina. Body, pedicles. And on the pedicle we have two plates like this. We call them lamina. Pedicle and lamina, they making arch. Os here. Two pedicle, two lamina, making arch. So vertebral body is here, number one. Vertebral arch is here, number two, behind the body. We have two pedicles, two lamina. After these parts, you can see that between body and arch we have foramen. Between body and the arch we have foramen. The name of the foramen, vertebral foramen. It's here. Vertebral foramen. Between body and the arch. Vertebral foramen. Vertebral foramen. Vertebral foramen of one vertebra attached to the another vertebra another. So these foramens make a canal. 1 foramen, 2 foramen, 3, 4, 5, all of them, all of the bones, the foramens alongside each other, and they making a canal. This is vertebral foramen, and look at the canal here. This is canal inside. So inside of the canal we have foramen, a spinal cord. Okay? Inside of the foramen, when a lot of foramen attached together, we have canal. Inside of the canal, we have a spinal cord for CNS, for nervous system. So this is body, this is arch, and this is foramen, vertebral foramen. After that, we have some process, xavoid process, okay? So how many processes we can see in one vertebra? How many processes? Two processes, they are transverse. Transverse process. Do you know the meaning of transverse? Transverse means yes. Transverse process. These two. This one and this one. To the right and left. One to the right, one to the left. Transverse process. They are here. Transverse process. One process go to the back. Transverse process right and left, but the spinous process goes to the back. You can touch a spinous process from the body, from the skin. This part of the vertebral column, you can touch. This is a spinous process. Spinous process. The posterior process, the single and long. Spinous. Spine means, what is the meaning of a spine? Shock. Spinous process is here. So two transverse process, one spinous process. A spinous process is attachment of the lamina. Lamina attach each other and making a spinous process. But transverse process, they are between pedicle and lamina. Here you can see two transverse processes. And final processes, superior articular process, inferior articular process. So what are these processes? Superior articular and inferior articular. Transverse process, they go to the lateral, joint, right, left. A spinous process go to the back. Superior articular process go up. Superior up. They go up. Two processes go up. One each side. Here, here, and here. Go up. Two processes go down. Inferior articular process. They are zone, paid. Superior, inferior. Like transverse process, they are paid. These are paid. Superior articular, inferior articular. Why? Because they attach to the up bone and down bone. For example, T10 attached to the T9 and attached to the T11 by this superior process and inferior process. Where is the location? Look at here. This is inferior articular process, but this one superior articular process. So it means one vertebra, it has two transverse process, one spinous process, two superior articular process, two inferior articular process. 7 processes. 2, 2, 2, 1. In this picture you can see again superior articular process, inferior articular process. What is the meaning of articular? Yes. Articular articulation means again mafsal, because they attach to the up and down. It means two bone attached together. What is the meaning of typical? Typical. Means normal. Means normal. It's typical, correct. Okay? But when we say atypical, if you add one A here, atypical, because it means it's not typical, it's not normal, it's not nemuna. So, if your vertebra has body, has all of the process, foramen, everything, so this is typical, normal. But we have some vertebra, they are not normal. They don't have some process. They don't have normal shape. We call them atypical. We start with cervical region. Cervical vertebra. We have 7 bones. And we show them by C, because they are cervical. C1, C2, C3, C4, C5, C6, C7. First of all, you should be able to distinguish the cervical vertebra with other vertebra. Means, so what is the difference of vertebra in cervical region and thoracic region and lumbar region? They have some differences. Cervical vertebra, they are specific vertebra, different shape. Thoracic region, they are a specific region, different shape. And lumbar region, they are different. The cervical vertebra, they are look like this. The normal cervical vertebra is look like this. Can you tell me what is the specific feature? What is the specific shape of this vertebra? Triangular. The foramen is triangular, yes. The vertebral foramen is triangular. So, it has 2 foramen in the transverse process. Transverse process, normally we don't have foramen. But cervical region, C1 to C7, they have process in the transverse foramen. So, foramen in the transverse process, right and left. Body, no, is normal, but it's very small. Body is normal, but it's very small. Look at here. The body of the vertebra. This is anterior view, lateral view, and posterior view. From anterior view, when you look into the vertebra, is like this. The body in cervical region is very small, but when you go down, the body, look at the size of the body, become larger. Why? Why the body of cervical vertebra is very small, but the body of lumbar vertebra is very big? What is the reason?
I told in Arabic, in English,
So tell me in Arabic. Yes, brilliant. The cervical region just controlling the weight of the head, just this. But look at the lumbar region. They're controlling all of the weight of the body, all of the upper parts. So for this reason, they are bigger. So cervical region. The vertebra, they have 3 points. It's specific to the cervical region, not to the thoracic, not to the lumbar, just cervical region. The third point is this. The spinous process is not one, divided to two parts. Look at here. Look at the normal vertebra, spinous process one. But in the cervical region, divide to the two parts, say by feet. So we have 3 points for the cervical region. 1, foramen in the transverse process. 2, a spinous process is by feet, has 2 parts. It's not. And vertebral foramen is like a triangular shape. So this is normal cervical vertebra. Normal cervical vertebra, they have this shape. But some vertebra, cervical vertebra, they are not normal. They are not normal, they are not typical. Typical are C3 to C6. C3, C4, C5, C6, they are normal and they have this shape. So typical cervical vertebra. Typical vertebra in the neck, they have this shape and they are C3, C4, C5, C6. But C1, C2, and C7, they are not normal. C1, C2, and C7, they are not normal. Okay?
Not normal?
Yes, not typical. When we say typical cervical vertebra, means normal vertebra in the cervical region. C3 to C6. But C1, C2, C7, they are not normal. Atypical, yes. So why, I will tell you. Look at the C1. This is C1. Why it's not normal? Look at the shape.
Yes.
Why it's not normal? What is the problem? Very good. No body. Where is the body? No spinous process. Where is the spinous process? No. It just has two transverse processes. So it's not normal, atypical. But it has transverse foramen. The point for cervical region. Transverse foramen. Okay? Yes, it has transverse foramen, but nobody. No spinous process, no triangular foramen. What is the shape of this bone? It has two arch. Anterior arch and posterior arch. Just two arch. The posterior arch is bigger. Look at here. This is posterior, because I can see it's bigger. The anterior arch is smaller, okay? It has two transverse processes. Transverse process they have foramen. Because all of the cervical vertebrae, they have transverse foramen. We don't have body. We don't have pedicle, lamina. We just have two lateral parts. Two lateral parts is bone. The name of C1 is atlas. C1 is atlas, the name of the bone. And it's atypical. So it superiorly C1 attached to the superiorly C1 attached to what? This is the first vertebra.
Occipital.
Very good. Attached to the occipital bone, occipital condyle, attached to that. Very good. So C1 atlas attached to the occipital bone. And the name of the joint, mafsal, is atlanto-occipital. Because it's between atlas and occipital bone. Atlanto-occipital joint. Atlanto-occipital joint. Atlantoaxial is between C1 and C2. I will tell you. This lateral mass, they are for attachment to the occipital bone. Superiorly attached to the occipital condyle from here. And here. Lateral mass. So the shape is very obvious, two arch, two transverse process, and this shape. C2, again, is atypical. C1, C2, C7, they are atypical. C2 is atypical. Why? This is C2, this is C1, this is C2. Why C2 is atypical? It has a spinous process by feet, normal in the cervical region. It has transverse process with foramen, normal. It has triangular shape, normal. So what is the problem?
No arch.
Notch?
No arch.
No arch, it has arch. Problem is in the extra process. This bone, it has everything. It has the 3 points, everything. But it has one extra process. It's go up, this one. So from body, one process goes up. So this is extra. So now it is atypical. What is the name of this process? Dense process or odentoid process. So C2, the name is axis. The name of C2 is axis. Again, it's atypical. Okay? And because it has dense process, extra process. So why it has this process goes up? Because C2 attached to the C1. C1 has no body. Body attached to the body with cartilage. So here C1 has no body. So C2, how attached to that? By this process. This process attached to the anterior arch, inside of the anterior arch. Look at the picture. Dense process or odontoid process attached to the inside of the anterior arch. So for this reason, we call it axis. What is the meaning of axis? The meaning of axis. Meaning of axis. Mehwer. Yes, because it has this process and it looks like mehwer is here. Yes, this is atypical just for this process. Just for this. C2 axis. C3, C4, 5, 6, they are typical and like this. Now C7. This is typical cervical vertebra. This is C7. Why it's atypical? What is the problem?
Long and wingspan.
Very good. A spinous process is one and long. It's not like other cervical vertebra, two. It's long and one. So for this reason, C7 also is atypical. Okay? This. I told you can touch a spinous process from the skin in the back, yes. But look at the neck. In the neck, you can't touch them. You have muscles, you have ligaments. The first spinous process we can touch is here. The first spinous process we can touch is here, and it's C7. So from C7, you can touch spinous process. From C7. But C1 to C6, you can't. It's muscle and ligaments. Okay? Because it's very long. And it's single, you can't touch it. C7. So this is cervical region. What you should know that all of these bones here, what are the most important point? Shape of these bones. They had 3 features. 1, cervical region, 7 bones. They have 3 specific points. You can distinguish with thoracic region and lumbar region. What was these 3 points?
2 loss of foramen.
Very good. 2 transverse foramen. All of the cervical vertebra they had.
Body.
Body is small, foramen is triangular, and finally the spinous process is 2. These points they are for cervical region. All of the cervical bones, no. Some of them are atypical. C1, C2, C7, they are atypical. They maybe don't have 1 or 2 of them. Okay? Thoracic region. I told you 3 points in the cervical region. Okay. What is the shape of the bones in the thoracic region? What is the shape of the bones in the thoracic region? What you can understand from the picture? What is the difference of thoracic bones with cervical bones, with lumbar bones? This picture.
Connected to the ribs.
Very good. In the thoracic region, we have ribs. These are ribs. What you say in Arabic to rib?
Allah.
Rib. So yes, in the chest, we have 12 ribs. 12 right, 12 left. They attach to the thoracic vertebra. In the back, ribs attached to the thoracic vertebra. So thoracic vertebra, they have this place for attachment of the ribs. They have this place for attachment of the ribs. So there, lateral side of the body, you can see the place for attachment of the rib. This is the point. You can understand this vertebra is thoracic vertebra. And it doesn't have transverse process from it. It doesn't have 2 spinous process. These are for cervical region. But this point, lateral side of the body, you have place for attachment of the rib. So what is the rule? Here is important. One rib attached to the, for example, rib number 5. We have 12 ribs, I told you. 12 ribs, I told you, and 12 thoracic vertebrae. 12 thoracic vertebrae. So it would be very easy if one rib attached to the one vertebra. For example, rib number 5 attached to the T5. Rib number 6 to T6. But it's not like this. It's not like this. What is the shape? One rib in normal condition. One rib attached to the same number, and a little one. Again, what happened? One rib attached to the same number, for example, rib number 5, attached to the T5 and T4, attached to the 2 vertebrae. Look at here, for example. Rib attached to the T. This is T5, for example. This is T6. 5, 6. This is 7, 8, for example. Rib number 5. Rib number 6. Rib number 6. Attached to the 6 and a little to the 5. rib number 6 attached to the T6 and a little to the T5. Rib number 7 attached to the T7 and a little to the T6. This is normal condition. One rib attached to the same number and a little superior. T9 attached to the 9 and a little to the 8. So rib number 6 attached to the 6 and 5. Rib number 7 attached to the 7 and 6. Now I remove the 6 to see that. Yes, to both of them. I remove to see that. The 6 to see that. 6. Upper part for rib number 6, lower part for rib number 7. This is T6. In the lateral side of the T6, we have two places. The upper part for the same rib, rib number 6, but the lower part for the 7 rib, rib number 7. This is important. So rib number 4 attached to the which vertebra? 4 and 2. Rib number 1 attached to the which vertebra?
1 and 2. Not 1. This one.
What is superior to the T1? C7 is cervical region. So it can't attach to the cervical region, just T1. So this is atypical, okay? Typical thoracic vertebra, they are look like this. Typical thoracic vertebra. They have body, they have pedicle, lamina, arch, foramen, superior articular process, everything. The spinous process is very long and it's inferior, everything is normal. Excuse me. So everything is normal, okay? But a spinous process is very long and inferior. What is the problem? The problem is lateral side of the body, we have a space for the ribs. So in this way you can understand that this is attachment of the rib. Hello. Okay, pay attention, excuse me. Lateral side of the vertebra, we have place for the ribs, right side and left side. So for which rib? This is T6, for example. This is T6. Which vertebra attached to the T6? Which ribs? So rib number 6 attached to the 6 and 5. Rib number 7 attached to the 7 and 6. So you can see the place for two ribs. The same number here. The same number here. 7 also attached to the 6. So the normal thoracic vertebra, it has two parts for the ribs. One up, one down. Which vertebra, thoracic vertebra, is typical? T2 to T8. 2, 3, 4, 5, 6, 7, 8. But 1, 9, 10, 11, 12, they are not normal. They don't have this shape. Normal is 2 to 8. 1, not normal, not typical. 9, 10, 11, 12, they are not normal. Okay? What is the name of this area? These are for attachment of the ribs. Ribs has one adjective, we call it costal. Costal. Costal means rib. Costal surface means rib attached to this surface. Costal space means between ribs. Costal is rib. So these are costal surface for the ribs. Okay?
Why is the no? Why?
This is the shape of this region. A spinous process, they are very long and they are inferior. They are not like this. They are like this, a little go inferior.
Why?
This is the shape of the bone. Thoracic vertebra, all of them, they are like this. Okay? The last point about attachment. The last point about attachment. Head of the ribs, I told you, attached to the lateral side of the body. Lateral side of the body. And also attached to the transverse process here. Look at the transverse process. Ribs also attached to the transverse process. So rib attached to the two parts. One to the body, yes. Another one to the transverse process. Attached to the two parts. Attached to the body and to the transverse process. So, anterior side of the transverse process, you can also see costal surface because ribs attach here. Here. Anterior side of the transverse process. Okay? T2 to T8. So, why other vertebrae, they are not normal? These are not normal, atypical. 1, 9, 10, 11, 12. 1, 9, 10, 11, 12, they are not normal. So why? Let me tell you. 1, rib number 1 just attached to the 1. Finish. The up is C7, so it can't attach to the cervical region. Okay? So for this reason, rib number 1 just attached to the T1. Finish. So it's not normal. In normal condition, rib attached to the same number and up. But now, just rib number 1, just T1. So it's not normal. Atypical. 12 is same. Rib number 12 just attached to the 12. Rib number 11 just attached to the 11. Rib number 10 just attached to the 10. So it's not normal. Okay? I told you normal condition. 12 should attach to the 12 and 11. But it's not like this. Just 12, just 11, just 10. So they are atypical. So why rib number 9 is atypical? Because rib number 10 doesn't attach here. It doesn't have this surface. So this one also atypical. So these 5 thoracic vertebrae, they are atypical. Question. All of the ribs attached to the transverse process, all of the ribs. All of the ribs attached to the transverse process here, except 11 and 12. Yes. So all of the vertebrae, thoracic vertebrae, they have this surface, except 11 and 12. 11 and 12. They don't have surface on the transverse process. But other vertebrae, all of them, they have this. Transverse process, ribs attached to the transverse process, except T11 and T12. Okay? Lobar region. Lobar vertebra. How many vertebrae we have? 5. 1, to L5. We don't have typical and atypical. All of them same, all of them typical. All of them typical. So what is the shape of this vertebra? This is lumbar vertebra. What is the difference of this vertebra with other vertebra? So, yes, the body is very big. The body becomes very big and like heart. From this point you can understand that. This is lumbar vertebra. The body becomes very big, I told you. The body in the cervical region is very small, but in the lumbar region is very big. You can see here. The process, they are very short. They don't have long process. For example, look at the spinous process. It's very short. Look at the spinous process of the thoracic region. Very long, thoracic region. But yes, in the lumbar region, the process, all of them, they are short, but flat. The process are short, but flat. And sometimes they have two small other process. Mammillary process, accessory process, they are here behind the transverse process and behind the superior articular process. We have two small process, mammillary process, accessory process. These are just for lumbar vertebra. So lumbar vertebra, these 5 vertebra, they have big body, they have a small foramen, vertebral foramen. Yes, the process is very short but flat, and you can see mammillary process and accessory process. So who can explain the difference of cervical vertebra, thoracic vertebra, and lumbar vertebra? For example, cervical vertebra, they have this shape, this one, this one, this one. Thoracic vertebra, they have this shape, this one, this one. Lumbar vertebra, they have this shape. For example, this, this. Who can I explain to other students? Volunteer. In Arabic, no problem in English. You can explain in Arabic. The shape of cervical vertebra, the shape of the thoracic vertebra, general point, and lumbar vertebra. You can? Come here. I help you, come here. You can speak in Arabic.
Cervical has a short spine and two short spine.
A spinous process.
And 3 foramen,
two transverse
foramen and 1 cervical foramen. Body like circle shape.
Body is small, but cervical region. The body is very small, so go ahead.
Um, 36.
Thoracic vertebra. What is the shape of the vertebra?
Long spine and pointed and narrow.
So long spinous process, and what did you say for that?
Pointed with a
For the rib. And it has place for the ribs. Ribs attached to the body here. Ribs attached to the body. What is the lumbar process? Lumbar vertebra. The shape of the lumbar vertebra.
Short process and with large body.
Yes, the
1 foramen.
yes, lumbar process. One foramen, all of the vertebra, they have one foramen, vertebral foramen. Okay? You should say the extra. Yes, the body is very big, and the process, they are very short, the spinous process is very short. Which cervical vertebra, they are atypical? Which cervical vertebra, they are atypical? cervical vertebra. Who can answer?
C2, C3 to C6.
They are typical.
Yes. 80.
C3 to 6, they are typical. Atypical cervical region, C1, C2, C7. Thank you so much. Thank you. Who can explain the typical and atypical vertebra? Before that, clap for her. Who can explain the typical and atypical cervical vertebra? The numbers you told me, C3, C4, C5, C6, they are typical. But C1, C2, C7, they are not typical. Why C1 is not typical? Why C1 is not typical? Why it is atypical? Because it has two arch, two transverse process. It doesn't have a spinous process. It doesn't have body. C2 is atypical because it has a dense process, extra process. C7 is atypical because it has long spinous process. In the thoracic region, which vertebra they are typical? Thoracic region. In thoracic region, the vertebra, they have a space, surface for the ribs. Ribs attached to the thoracic vertebra. What was the rule? For example, rib number 5 attached to the which vertebra?
Rib number 5. To number 5 and number 2.
Very good. Rib number 5 attached to the vertebra number 5 and number 4. But we have some ribs just attached to the one vertebra, like
Number 1.
number 1. Rib number 1 just attached to the T1, finish.
And number 2.
12, 11 and 10. 10, 11, 12. All of these three attached to the just one vertebra. Rib number 10 just T10. Rib number 11 just 11. Rib number 12 just. So we have 4 ribs. They just attach to the one vertebra. Rib number 1, 10, 11, 12. Lumbar region. L1, L2, L3, L4, L5. All of them are same. All of them are typical. The body is very big. The process is very short. It's not long. Transverse process, spinous process. They are short. These are lumbar vertebrae. So 1 or 2 minute rest, then we continue. We should finish at 3. The emergency calls, they told me we should finish the class today at 3, so we don't have 3 to 5. After 3 you can go, okay? 2-3 minutes rest. Jenny, it was 5, but now in adult after birth it's just 1 suck. This is suck. It's like a triangle. In fetus it was 5 bones. Now it's 1. It has 2 surfaces. It's in the pelvis. Look at here. Look at the curvature I told you to the posterior side. Sacrum attached to the pelvis. Excuse me. Attached to the posterior side of the pelvis. This is sacrum. Complete the pelvis. Okay? Sacrum. It has curvature, yes, to the posterior side. Lower part of the vertebral column. When we see this bone from anterior view, it has concave like this, and it's very soft. We don't have anything in the pelvis. This anterior surface. But posterior surface, it has a lot of roughness. It's not very soft like this. We have here some process. The posterior side of the sock. We call them crest. Crest means very thick border. Okay, I told you surface, border. When the border is very thick, we call it crest, like this. You can see some foramens in the sock between the bones, 5 bones in the fetus. S1, S2, S3, S4, S5, okay? The foramens now we can see 4 pair of foramens, right and left. Look at the posterior side. You can see them from anterior side and posterior side. They have this foramen, sacral foramen. Sacral foramen. You can see from anterior side and from posterior side. Why we have these foramens? Nerves from spinal cord. They go out from here. I will tell you. Okay, nerves. So from a spinal cord, they go out from here. After sacrum, we have coccyx. Coccyx. I told you this bone, it was 3 to 4 bones in the fetus, but after birth it is 1 bone. It's attached to the sacrum. This is coccyx. The lowest bone in the vertebral column. This is coccyx. I told you inside of each vertebra we have 1 foramen, vertebral foramen. Inside of each vertebra, between body and this pedicle lamina, we have this foramen, vertebral foramen. And I told you, when all of the foramen attached together, all of the vertebra attached together, they're making a canal. They're making canal for a spinal cord. A spinal cord is here. It's here. But you know that what is CNS? CNS. Central,
Nervous system.
very good, nervous system. What is the CNS? Which part?
Brain
And
and spinal cord.
very good. Brain and the spinal cord. They are CNS, center, مرکز, center of the nervous system. And we have PNS, peripheral nervous system. What is the meaning of peripheral? Mohiti. Peripheral nervous system, PNS. Which parts they are PNS?
Motor, sensory.
Motor and sensory? Nerves. Nerves, yes. But generally you can say nerves. So nerves, they are PNS. Brain and spinal cord, there's CNS. Nerve going out from here, they are PNS. How many nerves we have?
Sympathetic potassium.
No, they are very little details of this. I want that generally. Nerves. How many nerves we have? This is brain. This is the spinal cord. CNS. I told you they have nerves. Some nerves start from brain. Some nerves start from the spinal cord. These are nerves. So nerves, they are PNS. How many nerves we have? 12 nerves start from brain. 12 nerves, 12 pair. 12 pair start from brain and go out. Go to the face, go to the neck, anywhere. These nerves, we call them cranial nerve. Nerves start from brain, we call them cranial nerves. 12 pair. So 71 nerves start from spinal cord. We say spinal nerves. So these are PNS. 12 cranial nerve, 71 spinal nerve. Spinal nerve start from spinal cord. Where is the spinal cord? Inside of the vertebral column. So how nerves go out from here? How nerves from spinal cord, from vertebral column go out and go to the different parts? With some foramen. Which foramen? Let me show you. Let me show you the location of the foramens. Look at here. Between T10 and T11, for example, here we have one foramen. Between 11 and 12, between 9 and 10. So these foramens, they are between the vertebra, two vertebrae. Which part of the vertebra? Between pedicles. These are pedicles. I told you, after body we have pedicle. So pedicle of the superior and pedicle of inferior, when they attach together, they make a foramen in the lateral side, janib. Pedicle of the superior vertebra, pedicle of the inferior vertebra, foramen. What is the name of the foramen? Intervertebral foramen. This foramen is vertebral foramen because inside of the one vertebra, but this foramen, intervertebral foramen. Inter means between. Inter means between. When we say intervertebral, means between vertebra. Between two vertebrae we have foramen. So what is the benefits? Nerve. Nerve going out from this part. Look at the nerve aside. Go out from the intervertebral foramen. So intervertebral Inter means between, vertebra means vertebral column. Between them we have foramen, intervertebral for the nerves. You can see in this picture with more magnification. This foramen is intervertebral. Look at the picture. Body of the vertebra, anterior side. Intervertebral disc is cartilage, goes roof. Pedicle transverse process, the spinous process, and here intervertebral foramens. Joint of the vertebral column. How many joints after? We have between the bones. So the most important one is here. Between two body we have cartilage. Between two body we have cartilage. Disc. Intervertebral disc. Intervertebral disc. So this is joint, yes. Because two bones attached together. Two bones attached together with a cartilage. So this is joint of that. What is the type of the joint? How many types we have? We have three types of the joint in the body. Some joints, they have a lot of movement, like this. All of the joints, you can easily move them, they are synovial, like this, here, everything. So if you can move your joint easily, this is synovial. Second type is cartilaginous. We have those roof cartilage, and they have a small amount of movement, not like this, easily. Partial movement, a small movement. So like this, between two bones you have cartilage. For this reason we say cartilaginous joint. And the third type, sutures in the skull, very good. They don't have movement, they're fixed. We don't have anything between them. Fibrous joint. The type of the joint is fibrous. Like suture in the skull. The bones attached together without anything, and they don't have movement. So these are three major types of the joint. Some joints are synovial. Each joint you can move it is synovial. It has a little water and membrane, vessel and water. You can easily move that. Cartilaginous joint. Between two bones you have cartilage. This is one bone, this is one bone, between them we have cartilage. They have a small movement. Fibrous joint, no movement, immobile. Just attached together. So look at here. Between body of vertebra, we have cartilage, intervertebral disc, and this type of the joint is cartilaginous joint. Because between two bones we have cartilage. Intervertebral disc, cartilaginous joint. Yes, a cartilaginous disc attached to two bones, two body. So, do we have other place for attachment of the vertebra? Yes, superior articular process and inferior articular process. I told you they attach the bones together. Some process go up like this. Superior articular process. Two processes go down like this. Inferior articular process. So they attach together. Up to the down, down to the top. So here again we have joint. Look at here. Between superior articular process of the L3 and inferior articular process of L2. Here we have joint. Again, after. So what is the type? Synovial. This one is synovial because it has a lot of movement. But this one is cartilaginous. We have cartilage. This one is synovial. What is the name of the joint? Zygapophyseal. The name of the joint is this. Zygapophyseal joint. What is the type of the joint? They are synovial joint. But intervertebral disc is cartilaginous joint. one vertebra, body of vertebra attached to the body by cartilage, cartilaginous joint. Two superior articular process attached to the two inferior articular process. They are zygapophyseal joints, synovial, they have movement. Intervertebral disc. What is the shape of disc? It's cartilage. It's cartilage. It has two parts. One central part, we call it nucleus, like nucleus of the cell. You know that cell, one cell, it has nucleus. So this is nucleus. Nucleus pulposus. The nucleus inside at the center of the disc is nucleus pulposus. It is like a jelly. Water and a little, yes, jelly. Nucleus pulposus. Around that we have fibers. Annulus fibrosus. So one disc, one cartilaginous disc, intervertebral disc, it has two parts. Nucleus pulposus at the center is jelly, it's round like a ball. Around that we have annulus fibrosus. It's around that. Annulus fibrosus. And finally, two plates, superior and inferior plate, cover them. Just two plate covered. This is the shape of the disc, intervertebral disc. And final point for today. It's a clinical point. For example, if you measure your height at the morning, and when you measure your height at the night, it's not same. It's not equal. Which of them is longer? Morning or night?
Morning.
Why?
There is no pressure on the
Very
legs.
good. It's about pressure. When you wake up in the morning, you, for example, slept for 8 hours, 7 hours, 6 hours, your vertebral column is in the rest. The disc, they receive water, the jelly I told you, it's become bigger, is normal now. So your height, for example, is 183. But at night, after 12 hours work, go to the university, go back, play football, I don't know, everything you can do. For example, at night, when again you measure your height, 1 or 2 centimeter decrease, because this vertebral column make pressure on the disc, and disc, the water and jelly become smaller. So this reason lead to decrease your height, 1 or 2 centimeter. So it's better to measure your height at morning. It's longer. Again, you sleep, in the rest, the water go to the disc, jelly, and come back to the normal condition, okay? We continue that next session. Previous slide. Movement of the vertebral column, yes. They are related to the movement of the vertebral column. So let me explain this one as the last. Which part of the vertebral column it has very movement? Neck, cervical region, highly mobile. You can easily move that. And lumbar region. Lumbar region is very mobile. But look at the thoracic region, it's immobile. Movement of the thoracic region is difficult between bones. But cervical region is easy, lumbar region is easy. So for this reason, the problem in the disc of cervical region and lumbar region is more than normal, more than the thoracic region. Maybe you have heard that this, for example, person has problem in the disc, in the L3, L4. We say the name of the two bones. Disc between L3 and L4. Disc between L2 and L3. It has problem, hernia, rupture. So because here is mobile and here is very mobile. Yes, we have a lot of problem in the disc. You can see this can go to the one side, can go to the canal and make pressure on the spinal cord. Look at here. If this from here go back, go posterior, can make pressure on the spinal cord. So it's very dangerous. Usually if it's very severe, severe, they should do surgery and they should correct this cartilage. Why we have this problem? You mean this? A lot of reasons. For example, old age, a lot of incorrect movement of the body. For example, if you sit long time in an incorrect position, this problem. For example, when you work, your work is very physical and you pick up heavy structures, you can make pressure on the ribs and to the vertebra and the disc. It has a lot of reasons. Any question? I will see you next time.
End of our episode for today. Good night.